So who's a weekend warrior? So the Webster dictionary definition is a person who participates in a usually physically strenuous activity only on weekends or part-time. Read the little Urban Dictionary definition. I just thought it was funny. And then basically a weekend warrior is most of us, right? I mean, does anybody here exercise literally every single day? I don't have time to, but I try to exercise when I can. So a weekend warrior is most of us who work, who have lives and also want to stay active. So activity guidelines. ACSM stands for the American College of Sports Medicine, an association of trainers, doctors, and all of that stuff. So they have actual guidelines for physical activity. Bottom line is move more, sit less. Anything is better than nothing, but they recommend currently about 150 to 300 minutes. That's 2.5 to 5 hours a week of moderate intensity, or 75 to 150 minutes, which is an hour and 15 to 2 hours and 30 minutes a week of vigorous intensity aerobic physical activity. That's aerobic activity, and then they also recommend strengthening activity. So it's a mixed cardiovascular and resistance training program that they recommend. That's been shown to give you the best results and prevent the most injuries, and also be best for like your metabolism and things like that as well. So who gets hurt? So these pictures are meant to show that everyone does. So predisposing factors to injury, what makes us get hurt? So poor preparation or a poor fitness base. Intermittent participation, so if we're not working out on a regular basis, if we're just trying to stop and start and go all or nothing. Older age, increased weight. I put BMI in there, which is sort of a measure of weight versus height. And medical comorbidities. So that means basically other medical conditions that we have at any point in our lives. So high-risk activities, these are some of the ones that are most common in the literature as being high risk for weekend warriors. This is not just like younger people playing sports. This is all ages doing like weekend activities or recreational activities. This is just a list of common injuries. But if you guys look at this list, I mean, let me see a show of hands. Does anybody see anything on here that they may have had before? We can tell these are sort of relevant to general population as far as injuries. So for a lot of those common injuries that you saw, there are certain unifying treatment principles that we follow. Therapy, exercise. So exercise is like actually the mainstay of treating a lot of these injuries, but it has to be the right type of exercise. So after exercise therapy, I think about things like bracing in treatment of injuries. So after bracing and that type of thing, do we need any medications? I'm not a big pill pusher. A lot of people aren't big pill takers. However, they can be helpful to recover from injury. So we did exercise, we did bracing, we did medications. So injections are another way that we can help recover from some of these common injuries like the tendonitis or arthritis. So injections can also be used to help recover from these injuries. Now, who's heard all the buzz about stem cells, PRP, all that stuff? Has anybody heard of that stuff? Yeah, I'm seeing a lot of nodding heads. Okay. So I do that as well, and that can be used, and I wanted to bring it up because it's very relevant for things especially like the tendonitis, tennis elbow, golfer's elbow, shoulder, partial rotator cuff tears, the knee, arthritis, that type of thing. So again, too many conditions to list them all, but regenerative injections, or what are called biologics now, can be a very effective treatment. So when to see a doctor? I'm hoping some of these are obvious, but if they're like lots of blood, open bone, that type of thing, should probably be headed to a doctor. Loss of consciousness, maybe to an emergency room. If you can't walk, grip, or bear weight, so we have rules, things like for the ankle and the foot, if you can't take 3 steps, okay, that type of thing, it might be a good idea to go ahead and see a doctor. So what can we do to prevent these injuries from happening? So most of us are not the athletes that we were a few years back, but that's okay. We can set new goals for ourselves. We can still be competitive. We can still enjoy doing exercise. We just have to be able to build a fitness base, work our way up in our training. In general, you don't want to increase your training load more than about 10% per week. So that's something you can kind of go on as far as like how much more should you be doing, how much more intense, okay? and don't do too much too fast. So don't just jump in and think you're going to play at the same level you did 15 years ago. You know, kind of work your way in, see what you can do, see what you're capable of, and set new goals for yourself.